Hello everyone, now let us discuss about CPT coding guidelines for medicine part 6. In the current session, we will be discussing the special otorhinolaryngology services. Coming to these services, these are diagnostic and treatment services that are not included in evaluation and management services. This is an important point. These special services are diagnostic and treatment services that are not included in the E&M. Whereas some of the diagnostic and treatment services that are included in the E&M are otoscopy, anterior rhinoscopy, tuning fork test, removal of non-impacted cerumen, etc. And these services are not reported separately. The diagnostic and treatment services that are included in the E&M, they are not repeated separately. Example are otoscopy, anterior rhinoscopy, tuning fork test, removal of impacted cerumen. And coming to the evaluation includes examination of speech sound production, articulatory movements of oral musculature, oropharyngeal swallowing test, and qualitative analysis of voice and resonance. Some evaluations may also include patient's ability to understand the meaning of written and verbal expression, appropriate formulations, utterance of expressive thought. These are the elements that are included in the evaluation. Now let us take a look at the respective CPTs. The first CPT is 92502. It includes otolaryngologic examination under general anesthesia. The next CPT is 92504. It includes binocular microscopy. The next is 92507. It includes treatment of speech, language, voice, communication and or auditory processing disorder, individual test. This is an individual test. If the test is performed on group, that is 2 or more individuals, you need to report 92508. For the treatment of speech, language, voice communication and or auditory processing disorder for group, that is more than 2 individuals, 2 or more individuals, you need to report 92508. Coming to next CPT, it is 92511. It includes nasopharyngoscopy with endoscope. The next is 92512. It includes nasal functional studies. Example is rhinomanometry. If the physician performs rhinomanometry, you need to code 92512. The next is 92516. It includes facial nerve function studies, which are nothing but example is electroneuronography. If the physician performs electroneuronography, you need to report 92516. The next is 92520. It includes laryngeal functional studies, example aerodynamic testing and acoustic testing. And for performance of single test, you need to use modifier 52. And to report the flexible fiber optic laryngeal evaluation of swallowing and laryngeal sensory testing, you need to refer other CPT set, that is 92611 to 92617. We will discuss this when we talk about that particular topic. So 92502 must be reported for laryngeal functional studies, for aerodynamic testing and acoustic testing. The next is 92521. It includes evaluation of speech fluency, for example stuttering and cluttering. The next is 92522. It includes evaluation of speech sound production. 92521 includes evaluation of speech fluency, whereas 92522 it includes evaluation of speech sound production. For example, articulation, phonological process, apraxia and dysarthria. The next CPT is 92523. If the above test, that is evaluation of speech sound production with evaluation of language comprehension and expression. For example, receptive and expressive language, you need to report 92523. 92522 must be reported for evaluation of speech sound production. It includes articulation, phonological process, apraxia, and dysarthria. Additionally, if evaluation of language comprehension and expression is also performed, you need to report 92523. The next CPT is 92524. It includes behavior and qualitative analysis of voice and resonance. The next is 92526. It includes treatment of swallowing dysfunction and or oral function for feeding. Now let us see an example. A group of 4 persons with auditory processing disorder came to the physician. Evaluations and treatments has been made. Report the appropriate CPT. Here a group of people are undergoing the therapy. Group of 4 persons with auditory processing disorder. So the correct CPT is 92508. It includes treatment of speech, language, voice, communication and or auditory processing disorder. Here patients are having auditory processing disorder group. That is, for more than 2 individuals, you need to report 92508. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.